Good afternoon and welcome to today's episode of Living Well with Adena. I'm Dr. John Gabus. I'm the Medical Director of Community Partnerships here at Adena. And I'm the show's new moderator, so I'd like to thank Dr. Kataka for his service up until this episode. Adena, along with other healthcare providers and partners across Ohio, are distributing safe and effective COVID-19 vaccines to those who choose to be vaccinated through the state's vaccination program. Let's check in with Seth Haynes, the Director of Quality Process Improvement at Adena, for a brief COVID-19 vaccine update. Take it away, Seth. All right, so we'll try and get back to Seth whenever his audio is working. So sorry about that, but we will have our mass vaccination clinic open, and I'd like to especially thank the National Guard from Ohio, the Ohio National Guard, for being here and helping us have this be a very smooth process for all of those who are signed up to get the vaccine. And you certainly would ask, well, how do I get that vaccine? Anyone over the age of 18 can schedule an appointment to be vaccinated at 1-833-4-ODH. It's on your screen to take note. That's 1-833-427-5634, or visiting gettheshot.coronavirus.ohio.gov. No spaces, gettheshot.coronavirus.ohio.gov. And remember that you need to have an appointment. And once again, thank you to the National Guard for being here. I'm very excited to talk about our community health needs assessment. In 2019, Adena Health System, with its regional hospitals, the Adena Regional Medical Center, Adena Pike Medical Center, and Adena Greenfield Medical Center, along with many community partners, conducted what's known as a community health needs assessment. And this was accomplished by evaluating many areas of our life in the region, in Ross County, Highland County, and Pike County. And we were collecting and evaluating vital statistics, demographics, and public opinion data in all of those counties that Adena serves. This data is used to target health improvement activities and work on outcomes to improve the health of our citizens. Improvements focus on health inequities and socioeconomic factors that can lead to poorer health outcomes. Joining us to talk about this community health needs assessment is Kim Jones, Director of the Community Health and Development Department at Adena, Kelly Dennis, who's the Director of Health Promotion and Quality Improvement at the Ross County Health District, and Annie Howard, who is the Adena Advocacy Program Coordinator. So welcome to you all. Thank you for being here today.
Thanks for having us.
If you're tuning in live with us today, you can submit questions in the guest for the guests in the comment section. So please participate in the conversation. So Kim, welcome and thank you for joining us today. Can you tell us a little bit about yourself and how you arrived at this role?
Oh, thank you very much for having me. I appreciate the opportunity to talk about one of my favorite subjects. As you said, my name's Kim Jones, and I'm the Director of Community Health and Development for Adena. That department really focuses primarily on assessing our community's needs, but also really looking at developing strategic plans, initiatives, and programs that will help address those needs that we find. I have a background working in social service and a lot of different entities and different communities. Rural communities are my favorite. So this role was definitely something that I cared about. I actually also grew up on the southern end of Ross County, so that's definitely something that holds it close to my heart as well.
Well, good. Thank you very much, and thank you for the work that you do. And Kelly, tell us a little bit about yourself and your work with the Ross County Health District.
Yeah, Kelly Dennis. I'm with the Ross County Health District. I'm a resident here in Chillicothe. I live in this community. I started working in public health back in 2005 after I graduated college. Working with Ross County, and then I went and worked in Pickaway County for a little while, and then returned back in 2017 to the Ross County Health District. I started working with Kim shortly after that on our community health improvement plan from the 2016 health assessment. I learned a little bit, or not a little bit, I learned a lot about health assessments through the health district's accreditation process, which that was one of the key parts of us becoming an accredited health district. And then I was able to work with Kim and our community partners on the 2020 Community Health Needs Assessment. So, we've had a good working history over these last 3 or 4 years, working with our partners for a healthier Ross County, and then also working alongside with Adena on this health assessment.
Great. And Annie, we'll get to you in just a few minutes. So, Kim, let's talk more about the Community Health Needs Assessment that you and our community partners, it's not just an Adena initiative. We have many different partners who are helping us with this. And we have to complete this every 3 years as a community. What is the assessment and why is it so important to our community?
Assessments really got started because hospitals, as well as health departments, as part of their ongoing accreditation processes and things like that, are required actually to do assessments, as well as not only do the assessment, then figure out some plans in terms of what they're supposed to do. So it got started that way. And for a long time, a lot of organizations were just kind of working in silos. They do their own plan and that type of thing. But we really, as a community, really thought it was going to be much more beneficial if we tried to do one collaboratively, because then when we developed plans, we would actually be able to not duplicate things and maximize what limited resources we have here in our rural community. And so that's why it's been great to work with the Ross County Health District, as well as the Pike County Health District and the Highland County Health Districts, because they really, coming to the table, were able to create plans and that really impact the communities in a really important way. And it also has really been great to build the partnerships too, because we've come up with some great ideas together, putting our heads together for things and not just trying to do it all by ourselves.
That's great. And I know that when everybody is working together and pulling in the same direction, you can get a lot more done in one agency by itself. And Kelly, could you tell us about how the data was collected, or maybe how it was put together to educate us about the needs in our community?
We have secondary data and primary data, which secondary would be your information that we get from a variety of sources like census data and stuff from data from the CDC, or even from Ohio Department of Health or some other nationally or state level data systems. The primary data is what we collect locally. So we rolled out a survey, and it went for several months. The survey was not, it was created by our partners. So, say if there was a certain agency that wanted to have a specific topic investigated, we could get that into the survey. So if it's a partner that focuses on mental health, we could get those questions in the survey, or if it's a partner that focused on diabetes or chronic disease, we could get those questions in the survey. So the primary data was collected basically from our partners wanting to get the questions answered that we put into the survey. We had over 1,000 respondents. And it took 2 or 3 months to get those responses. We utilized a contractor to help analyze some of the data. That was something that was very helpful to have that information, the data cleaned and analyzed and given back to us to where we could get it into the report. But it was a very good process this second time around when we did it in 2019. And we added on to the information that we gathered in 2016 by digging a little bit deeper into the information that we were gathering.
Sure, I'm sure each one will be a learning that reflects
Yeah.
The areas that we needed to improve in our survey.
Yeah, and it was really great to get the community's feedback too, because to Kelly's point, when you do the analytics, you're able to then look at it across different populations of people too. What is really impacting one group maybe versus the other, and that also helped us develop those questions too, because we really got some more in-depth questions. It wasn't just about people's health and their habits this time, but we really got more in depth about how they're living and their quality of life and things that might be going on in their life that could be really impacting their health.
Yeah, we don't want to focus just on the negatives. We want to
Yes.
focus on what are some of the positives that's happening in our community.
Mhm.
So once you got the data and you analyzed it, Kelly, what were some of the major learnings or major understandings about this data in our community?
Yeah, when we looked at the questions, we obviously asked answers on income and age, or asked questions on income and age and some of the background information during the survey. That way we could compare those self-reported outcomes to those factors. And that was very important, as we wanted to dig a little bit deeper on the factors that can lead to poorer health outcomes. We did recognize that income is a contributing factor. In some communities you might have ethnicity or race. One of our leading factors was income. We did find a lot of the outcomes that we worked on in 2016 on the assessment were still some of the leading causes or outcomes. Mental health, obesity, those rose to the top as they did previously before. So definitely the assessment allows us to gather that information so we can start targeting coalitions or focus groups in the community that can battle those health issues.
Mm-hmm. Yeah, I'm sure that it's the long haul view, because there's no one thing that's going to magically improve health over a community or over a region. So I think we have to be patient but diligent,
Yes.
all at the same time. Kim, how are these assessments leading to impacting our community and the community's health?
Well, as Kelly said, we were able to get a lot of different, not just the basic state of health for people and behaviors and things, but we were also really able to look at underlying issues that were a part of that. And we were able to then break our coalition out into teams of people that were able to work on specific issues. We've got a mental health forum now in Ross County. We've got smoking cessation and prevention efforts going on all of our counties now, because lung cancer and heart disease related to smoking was, certainly something that came out of our health assessment for the entire region. And so with all that information, we're really able to then take that and build the infrastructure that we need to do things. And so these groups can focus on that. They're focused on one problem. They're not trying to do a whole bunch of things all at once. They're focused specifically on that. And so out of that, we've had a lot of great initiatives that have come out of that. You've got everything from, one of the things that we couldn't find information on before is air quality. A lot of people wanted to blame air quality on things, but it's like, well, if we don't have the data, so the health department took the lead on that, and we now have purple air monitors installed across Ross County. You can go to purpleair.com and look at the air quality that's there. That just was infrastructure we didn't have before. There's also efforts being led by like the Hope Partnership Project that is specifically focused on substance use disorder. Tons of work being done there to do outreach and get people into treatment, expand treatment options, and all those types of things. And so that information is really powerful, because then you're really able to understand where the gaps and the needs are, and then you can really focus your efforts on doing things that are actually going to impact it.
Good. Yeah, the Hope Partnership Project is near and dear to my heart.
Yes.
as a coalition.
Yes.
So one of the important things, Kelly, I think, is making sure that our community is aware that this survey is ongoing. And whenever we start this in 2022, Could you tell us how the community can support this effort?
Yeah, I think the easiest way to support it is to join some of our coalitions. One thing we did notice throughout this process, we have pretty good engagement from our community organizations and agencies, but we always welcome people to sit on these coalitions. If you're just a member of the public, or if you're a parent, or if you're just anyone in the community can sit on those organizations and contribute. Especially those that have lived the experience. That's always helpful to have someone that's experienced some of these health issues, to have them give their feedback on how we can, fight these issues within our community. The information you can find it on our website, rosscountyhealth.org. Adena keeps the health assessments on their website as well, so that information is available. And in additional to that is. We do continue to collect data on a yearly basis, not just during the years of the assessment. So some of these coalitions or these project groups we might do additional investigations or assessments to find out more detailed information about a certain subject. So we do collect, it's an ongoing gathering of information.
Good, and it's good that we're continuing to get that information. Last week, we officially passed the 1-year mark in the pandemic from COVID-19. This past year has been hard on all of us. What health issues are you seeing at the health district that are occurring in our community because of the pandemic? What are some of those that you've noticed?
Well, first of all, I think it still might be a little too early to tell exactly how this pandemic affected many health outcomes. One that we do know that we've been tracking, and it's information that's readily available now, is our overdose deaths. In 2020, we had an increase in overdose deaths from I think it was 36 in 2019 up to 55 in 2020. That's an indicator that yes, the pandemic could have had an impact on health outcomes. I think it's for some of our other health outcomes. Some of our chronic disease and stuff, it might be too early to tell. All the data hasn't been officially published. A lot of our death data doesn't get certified till mid-year in 2021. That's, calculates the results of the 2020 data. So I think there's still going to be a lot of assessing on how the true impact of the pandemic is on our health outcomes here locally.
Okay, thanks.
Mental health is probably one of the top ones that you would see that, and whether it's related to substance use disorder. Another thing that we found in the assessment that I didn't mention earlier, but we've definitely seen an increase in is interpersonal violence, and just in general, depression and anxiety. A lot of the things that, having to be quarantined and all those types of things lead to for people, especially kids, because kids have had a pretty, difficult year themselves too, being in and out of school if they were in school at all. So I think mental health probably will be one of those things. But to Kelly's point, there we'll probably see a lot of other things as well.
So we've illustrated some of those issues. What are the resources that are available, Kim, in our region for people who are dealing with some of these negative emotions or impacts from the pandemic?
We're very lucky here in Ross County and in the surrounding area to have a lot of mental health providers that you can do outreach to. I've been so pleased to see the billboards and different numbers and things that they put out that people can reach out to when they are feeling sad, lonely, or just, in crisis. We also locally have here in Ross County and the surrounding counties, we also have a 211 line. A lot of people might not know what 211 is. That is a telephone line that you can call 24/7 and ask for any type of need that you might have, whether it's a mental health need of any kind, whether you are having trouble with employment, maybe you need housing or food assistance. I mean, it's designed to be that kind of clearinghouse for people that they can call in order to get access to the many, many resources that we have here. Kelly's mentioned, a lot of our partners and folks that participate from social service agencies. There really are a lot of resources around everything from food to mental health resources, substance use disorder, housing. All these folks can be accessed through that 211 line.
Yeah, I think that's a very important point. We have many resources that if you're aware of them, you can take advantage. If you're not, then it's a little bit
Yes.
harder. In your Department of Community Advancement and Development, in collaboration with our community partners, I'm sure that all of us strive to give the best opportunities for those in our communities to live and lead healthier lives. What are some of the community health programs that are sponsored by Adena?
From Adena's standpoint, we've got a lot of great partners that we work with to do things like, for example, our Food RX vouchers that we do for patients that might be having issues with food security. That's a partnership with our local farmers markets in the regions where people can take the vouchers and receive fresh food, up to $15 per visit for that. So those are some of the things we do. We have a Walk with a Doc program, and that's really designed to get people out moving, as well as getting a little bit of education on a medical topic while they're there. We also partner with our friends at OSU Extension to do Cooking Matters, which are cooking classes that really encourage people with healthier nutrition and those types of things. We also partner with our friends at the YMCA around diabetes prevention, as well as a program we call First Step for orthopedic patients and those types of things. So we're very lucky that we have partnerships from those folks, and they're tied back to and being so committed to helping with us with this plan.
All right. Can you talk about what grant-funded programs there are at Adena? We want to be sure that we take advantage of funding sources, and what might some of those be?
We partnered, one of the grant-funded programs we did, we partnered, the Health District was one of those partners, but we have Ohio University, Chillicothe, and Community Action here in Ross County. We all went together to write, with Hope Partnership Project, to write a grant to support efforts around substance use disorder in the community. Adena employs the program coordinator for that, and she works with all these various agencies and working around treatment, recovery, and prevention efforts around substance use disorder to make sure we've got as many resources as we have here in the community as possible. We also saw that interpersonal violence was a real issue, and the Adena Health System is actually the regional advocacy service provider. We have advocates that are funded that respond to our hospital emergency rooms and urgent cares 24/7 for anyone that might be experiencing interpersonal violence. So that includes sexual assault cases for children up through people who are elderly. So it's a very important program, and one that we see people from all over the southern part of the state for. And then accidental death, was a third leading cause of death that we'd found in the assessment. And we actually operate, that was around overdoses, which is why we have the one program, but we also have a grant that's around the second leading cause of death, which is automobile accidents. And so we actually coordinate a traffic safety program that encourages people to wear their seatbelts, not drive while intoxicated or texting, and those types of things too. So those are just a few that we have, but they're definitely ones that we built around our community health assessment.
Great, and thank you for your insight, Kelly and Kim. We're going to kick it back to Seth, who is hopefully with us electronically. So Seth, if you can give us an update on the COVID-19 vaccination site.
Thanks, Dr. Gavis. I somehow muted myself accidentally. So I know Fred Yingling's usually on here. He's our director of pharmacy to give this weekly update, but he's enjoying the Florida sun this week. He took a week off. So we started our public vaccinations here at Adena on January 20th. We were selected as one of 16 mass vaccination sites in the state of Ohio by Governor DeWine. Planning for this mass vaccination site started in March, early March of this year. I've been working with the Ohio Department of Health, specifically Ryan Morrison, who reports directly to Governor DeWine, Accenture, who has developed their vaccine management solution product, and that person's name is Michelle Brown. And then, like Dr. Gabus mentioned, if you've visited our mass vac site or plan to visit our mass vac site, we've been working with the Ohio National Guard. That's been Master Sergeant Ashley Blackburn. It's been really great to work with the National Guard. Really, we couldn't have done this without their support and help. So really want to thank them for their service and helping us get our community vaccinated. Our mass vaccine site opened on yesterday, actually, March 31st, we saw 700 patients yesterday. We have 950 scheduled today. We're open for next week now. I actually loaded those in the system this morning. You can get an appointment at gettheshot.coronavirus.ohio.gov. You have to select zip code 45601 to select our site. Anyone can sign up no matter what county you live in. You don't have to be a resident of Ross County or a county that is in Adena's market area. We've seen people this week that have been from Franklin County, visit quite a few actually. So we expect to receive between 2,500 and 4,000 Johnson & Johnson doses weekly from the Ohio Department of Health. Again, the Johnson & Johnson dose is for 18 years of age only. So if you're less than 18 years, please don't sign up. You'll need to get the Pfizer vaccine that's approved for 16 and 17-year-olds. We've also been working with 14 county transportation departments for individuals who might not have access to vaccines otherwise. You can find transportation at adena.org. Then you select our COVID vaccine info, and then you select transportation assistance. And we have several counties now that are set up that if you need transportation to our vaccine clinic, you can set that up on that website. Ross County is currently vaccinated 20,000 residents, and that's about 26% of the population in Ross County. Our mass vaccine clinic will be open through May 21st. We've had several visitors in the last week. U.S. Congressman Brad Winstrup was actually here this week and visited us, as well as we expect Governor DeWine to be on site. I really want to thank everyone at Adena who's helped with the mass vaccine clinic planning and operations, specifically Dave Tippy, Richard Ash, Fred Yingling. Can't say thank you enough to the Ohio National Guard. As Dr. Gavis said earlier, couldn't have been able to pull this off without them. Getting vaccinated is the path to ending this pandemic for everyone. So if you want to get a vaccine, please come to Adena. We've got appointments open now. Thank you, Dr. Gavis.
Welcome, Seth, and thank you and all of the people behind the scenes that have been helping you make this a smooth process for all of our fellow citizens. And once again, reminding everybody that Adena is one of 15 mass vaccination sites. Johnson & Johnson is the vaccine that's being used. The best vaccine is whatever vaccine you can get into your arm. So currently it's a Johnson & Johnson exclusive site. Anyone over the age of 18 can schedule by going to gettheshot.coronavirus.ohio.gov. You can also call 1-833-4-ASK-ODH, and that's 1-833-427-5634. So thank you, Seth, and the National Guard. So let's turn our attention to a different topic, but it's also related to the health in our community. April marks the 20th anniversary of the Sexual Assault Awareness Month, and this was originally coordinated by the National Sexual Violence Resource Center. The Sexual Assault Awareness Month raises awareness and helps to educate communities and individuals on how to prevent this type of sexual violence. The color teal and wearing a teal ribbon shows support for victims and serves as a reminder that sexual assault continues to be a very serious and widespread problem, and it's a violation of our human rights. So, Annie, thank you for being patient in participating in the episode today. Annie Howard's the director of our Adena Advocacy Program. So tell us a little bit about yourself and how you found yourself in this role.
Yes, absolutely. Thank you for having me today. My husband and I moved here about 16 years ago to pastor a local church here in town. And we absolutely love that opportunity. And after we were here for a few years, we had a young member disclose abuse. And I honestly had no idea how to help her, where to turn, where to look for resources. Obviously, we did get her help, but we really struggled with what to do and how to help. So fast forward about 10 years, I decided to go to college. And while in college, I had met our manager of our program, Heather, and an advocate that came into the class and just talked about what they do, how the program helps people with interpersonal violence. And I was just amazed with what all that they were doing and helping with. So I started volunteering for our program. And then I did my practicum for college with them. And then they hired me as an advocate. And now, about 2 years ago, I became the coordinator over the hospital side.
That's terrific.
Thank you. There's also a little extra things that I do as well. There's a faith-based side to our program as well. And so now if I'm given the opportunity, I go into churches and educate them on interpersonal violence and how they can see signs of a victim maybe in their church or around their community. And I'm really passionate about that since that now I can help others since I didn't know how to do that a few years ago myself.
Well, just having a resource that people feel comfortable opening up to is a critical component. And thank you for both sides of that, the advocate side and the faith-based side.
Thank you.
Because it takes a lot to heal those folks.
Absolutely.
It's a serious public health issue. And can you give us an idea about the severity of this, or what have you seen in our region as some of the outcomes of interpersonal violence or sexual assault violence?
Yes. Well, nationally, we've seen over 433,000 people above the age of 12 that has experienced sexual violence each year. Here locally, we had over 445 people that came in with interpersonal violence, and around 49% of those reported experiencing sexual violence here in our community and local communities.
Wow, that's I'm sorry to hear that, but it's good that we're getting the word out that this occurs, and getting the recognition that we have to pay attention to the incidence that's that high. Statistics show that the COVID-19 pandemic and the isolation of having people to stay home, we've talked about that just a bit, and the incidence of interpersonal violence has increased. Sexual assault episodes have increased during the pandemic. If there is a survivor of abuse who needs help that you come across, what's the first step to getting them help?
Getting them connected to resources. So, experiencing interpersonal violence is an altering moment in their life. So getting them to a program like ourselves that's going to be able to link them with local resources in our community and help navigate that for them. That's why we're here and that's why we exist, is just to make a difference and to help lead and guide them. So getting them connected with us or other resources in their area is a great first step.
Yeah, that connection is so vitally important.
Yes.
What are some of the warning signs that community members or pastors or people who might be in leadership in organizations, what are some of those signs that may give us a hint that somebody might be a victim of sexual violence? And what should that person do to help?
There's some signs that are similar for children and adult, and then there's some that's a little bit more targeted depending on the age. But for children, just if they have more knowledge of sexual topics than what they should at their age, regressive behaviors or maybe returning behaviors such as bedwetting or sucking their thumb, those can be signs of abuse. If they don't want to be left alone with certain people, that is something to watch as well. Adults, self-harming, a lot of sexually transmitted diseases, an increased use of drug and alcohol use are just some of those signs to kind of look for them. And if you're wanting to help them, again, getting them connected to a program that is going to give them those resources to help them emotionally and navigate through them, getting them linked up with counseling and things like that to help them through this.
So would 211 be a resource for them to access those services?
Yes, absolutely. That's going to give you all of the resources here in Ross County.
Terrific. So I know that you're the coordinator of the Advocacy Program, and I'm anxious to hear what that program is and how it helps the members of our community who are victims of violence.
Yes, so we help serve the needs of adults and children who have experienced interpersonal violence, like Kim had stated. So that would be sexual violence, domestic violence, child abuse, elder abuse, human trafficking, and even those who have experienced hate crimes. And so we become involved typically at the emergency departments or urgent cares, and we offer them that crisis intervention as soon as they come in, and we're there to support them. We're available 24/7. So there's an advocate available at all of our locations of our emergency departments.
Okay, that's awesome. That's a comforting blanket over our region. Adena has 11 sexual assault nurse examiners. I'll ask you to explain what that is, and also to explain what a forensic exam is whenever somebody comes in that has suspected abuse or violence. And how do those sane nurses provide holistic nursing care to those folks? And if you're a survivor of a sexual assault episode, how do these nurses support those patients?
Okay, so when they come in for a forensic exam, used to be formerly known as a rape kit, they come in, there's a lot of swabs. The nurses are so amazing to really calm the nerves of adults and children. We have, our youngest patient has been 2 months old. Our oldest patient has been 87. And so we are there, and so are the same nurses, to just support them through the whole process. They are great to explain each step that they're going to take, allowing them to choose what they would like to be done, because as they make those choices, they regain back independence for themselves. And so the SANE team is amazing. They come in, they do a head-to-toe assessment. They're instrumental in collecting that forensic evidence that we need, doing photo documentation, giving medication that's needed after a follow-up. And so something that makes them really unique, though, is that we are the only SANE team in Southern Ohio that is trained to help with children exams. So a lot of places have adult exams, but they're not trained to be able to handle children. And so we have seen people come from West Virginia, Kentucky, Indiana to Adena so that we're able to help facilitate that exam.
Wow, that's awesome that service is available. What other crisis advocacy services fall under your area?
Yes, so we offer, like I said, the emotional support. We're available 24/7, getting them linked up with resources, getting them to shelters or safe homes, linking them with transportation. Those are types of things that we help them with. We're there through the whole medical experience for them, making sure that they understand what is happening, what's going to come next, that their rights aren't violated in any way, and that they have the choice to decide what to do next.
Okay, thank you. So I know that an episode like this is a life-altering and life-changing event for a person.
Mm-hmm.
How does your agency or your group provide follow-up for them?
So we have an aftercare coordinator, and she is amazing at getting them resources as well. She focuses more on community resources and being able to link them up. She also does follow up with physicians that they need after the exam. She even will go with them to the exam and be that support while they're disclosing to their doctor what has taken place. She also provides shelter and works on getting them home, safe homes, clothing, food. If they're not able to have their basic needs met, then they're not going to be able to move forward and to complete that healing process. So our aftercare advocate usually follows up within 96 hours of being seen here, and she typically works with them for about a year just to make sure that all of their needs are met, and if they have any barriers, she's there to be able to help them face those.
And thank you so much for being there for these vulnerable members of our community. What can the community or healthcare providers do to help support victims of sexual violence or interpersonal violence?
Yes. So when somebody discloses to you you believing them and validating it goes a long way. Also, just listening, don't underestimate that. That is a huge help for somebody that's just experienced sexual assault. So looking for resources, maybe using the 211, Google some resources for yourself so that you can help them, but offer to go with them. Hey, can I go with you to your appointments? And just connecting them with even programs like ourselves here, calling us at our main campus. We also, if they don't come into the emergency department, they can call our office and we will still do community referrals and still continue to help them.
Okay. Well, thank you, Annie. That's very, very important work. Thank you, Kim, for your work in community advancement and development. And Kelly, thank you for being at the Ross County Health District, helping our communities stay healthy. Thank you very much for joining us today. Be sure to follow us on Facebook and Instagram to get the most up-to-date information on COVID-19 and other important health topics. Reminder that the vaccination appointments can be made by calling 1-833-4ODH or 1-833-427-5634 or visiting gettheshot.coronavirus.ohio.gov. So thank you very much for tuning in today. Our next Living Well with Adena will be April the 15th. Thank you and have a wonderful, beautiful spring day and happy Easter.